Biden falls. Hello and welcome to the channel. In this week of dramatic news from US politics, I turn my attentions to across the pond, even though I am neither American nor political. Neither being necessary, I reiterate my usual disclaimers. I am focused on medical issues, be they in unknown subjects or in the well-known. Nothing I say or use to illustrate my cases are designed to hurt, upset, or offend. I am simply discussing human medical issues, often using famous faces as illustrative cases. Disclaimer out of the way, let's dive into today's matter. Yes, I am referring to the repeated falls of President Biden, which are of course concerning. Now, I don't know the exact cause of his falls. What I do is piece together the evidence available and come up with a good hypothesis, an educated guess. Falls are of course never funny. It shocked me somewhat that President Biden was mocked as he fell several times going up the steps of the Air Force One presidential plane 3 years ago. If he were not the President of the United States of America, I doubt that anyone would have laughed. Granted, as president, it is alarming that someone with his health challenges, which we can all see and hear clearly, is at the helm of one of the biggest economies on earth. Falls are so important in the elderly that they have their own department in most hospitals and clinics in modern-day medicine, with falls action strategies in place in most hospitals. This is an interesting trend nowadays in medicine, by the way. In the old days, if you were prone to falls and were over 65, you would be sent to the geriatric medicine doctor, elder care specialist, geriatrician. If your general practitioner, your GP, thought they had identified your exact cause of falls, you may accordingly be sent to the cardiologist, neurologist, or ENT doctor, ear, nose and throat specialist, if they thought your problem lay with your heart, brain, or inner ear or balance center. But now you can be sent to the falls clinic and you can see any one of these specialists there. The cardiologists and neurologists have also combined forces and run together a syncope or blackout clinic. The gynecologists and urologists, not to be outdone, have a genital or bladder prolapse clinic, where with age, your womb or bladder can sink right down such that you may be even able to feel it right down, almost outside your body. Neurologists team up with geriatricians and psychologists to run memory clinics where dementia patients are assessed. In this photo, I see the word Bidenomics. Would that be Biden ergonomics, as in the science of adapting the workplace to fit the worker in order to reduce risk of injury? Or perhaps it means Biden economics. More likely the latter, I guess. But if the former, then it's clearly ironic, no? What do we make of Biden's gait, or manner of walking? To a doctor, he has a rather stiff gait. Now, before we scream Parkinson's, we need to take into consideration the possibility of a musculoskeletal problem. And indeed, this has been stated in Biden's case. He apparently has osteoarthritis of the spine, basically wear and tear with time, with age, and this is painful and can stiffen your gait. By the way, another characteristic of Parkinson's is a rather expressionless face. I don't think Biden has this, although I have to say there is some paucity of expression there. But then this could be due to cosmetic surgery. I believe he's had some. Wherever his facial expression is, it's not quite as bad as this. This is the face of Pope John Paul II. He, of course, being a famous person who did suffer from Parkinson's and who also has the typical speech of a Parkinson's patient, as well as a tremor. I should say who did, because of course he has been deceased for many years. The tremor is known as pill rolling because it literally looks like the patient is rolling a pill or small object between their thumb and index finger. And the rigidity of body known as cogwheel rigidity because, well, it looks like a cogwheel. It's a bit clunky. I have never seen this tremor in Biden. A peculiar feature of Parkinson's is that when the patient, whilst walking, if they need to make a turn, they can't turn in a fluid manner. They have to turn the whole body. This I have seen to a lesser extent in Biden. What's more prominent, however, when one watches him walk, is how high his feet are raised with each step. This is typical of nerve damage in the feet, what is called peripheral neuropathy, a specific type of which causes a so-called drop foot. Whilst drop foot is usually unilateral, Biden seems to have both feet exhibiting this particular sign. He seems to exhibit bilateral drop foot. Another prominent feature of his gait is this forward-centered type of gait or walking style, which, to be honest, most older people do have. Older people seem to move forward with their center of gravity for one simple reason, and that is the back muscles, specifically the ones that hold up the spinal column, the so-called erector spinae muscles, are less strong than they should be. Think about it. You hardly see an older person walking with a straight back. More often than not, they lean forward. Did you know that this can be corrected and even prevented? You know how. Start doing your back training exercises today. Very important. Biden shows this a little when he walks. The leaning forward thing. But one reason he may do this is maybe to watch his feet. Simple as that. To scrutinize the ground before him to avoid tripping on something, which is of course logical. Safety first. Very often, especially if with age your eyesight is going, you need to be able to be sure of where you're placing your foot. One feature of a Parkinsonian gait he definitely does not exhibit is the marche à petits pas, which is translated from French, the short, shuffling type steps that Parkinson's patients make. Biden's steps are long and actually of normal rate, maybe even a little slow. It's definitely not the fast, shuffling type of walk that I often see in my Parkinson's patients. But it is not just the gait which predisposes one to falls. Eyesight, as I've already alluded to, is also very important. I talked about Biden's slight stoop. Anyone of any age, if they are unsure of where their feet land with each step, will be prone to falls. This is why some elderly people squint when they are trying to concentrate on walking. And often it's difficult to do other things whilst walking, even talking. That's multitasking to elderly people. Because, after all, a false step could be the beginning of a long journey, starting with a hip fracture, especially if the ground is icy or full of snow. So be mindful that an elderly person walking a bit unsteady, they need to concentrate. Don't distract them by talking or otherwise taking away their attention from their full concentration on their walking. Hearing is also a factor. If your hearing is impaired, you need to be more vigilant on the streets to stay safe. It means you need to look around yourself more, to scrutinize your surroundings for sources of danger, the passing cars, a dog, a moped, etc. These are all little distractions, little accidents waiting to happen. So it's very important for an elderly person to literally have their wits about them whilst they are outside, especially in unfamiliar surroundings. What is known about Biden's health is that he has had 2 brain aneurysms, swellings on the arteries in his brain, which have been repaired, apparently. These surgeries are quite touch and go, and frankly, he's lucky to be alive. He has also had atrial fibrillation, which is an irregular heart rhythm that leads to strokes if not well managed, with anticoagulation or blood thinning. What is often a major conflict of interest in medicine, and I talk of others in this video here, linked above, is that Biden is most definitely on anticoagulation medicines to reduce his risk of stroke, based on a scoring system known as CHA2DS2. I talk about CHA2DS2 in the context of medical scoring systems in this video here, which I shall put at the end of this video as an end screen. It is also general knowledge that he has sleep apnea syndrome because he is on the treatment for it. A breathing apparatus known as a CPAP machine. Atrial fibrillation does tend to be linked with sleep apnea syndrome. What is unusual here is that sleep apnea tends to affect people of a higher body stature, meaning body weight, than Mr. Biden. His slim frame is not so typical of sleep apnea patients. In fact, another name for sleep apnea is Pickwickian syndrome, named after the character Joe from the 1836 Charles Dickens novel, The Pickwick Papers. But hey-ho, there are always exceptions in medicine. In summary, yes, I would agree that Mr. Biden has a rather long list of possible risk factors for falls, with or without cognitive decline. Normal aging alone is a risk factor for falls. Hoping he's able to find good solutions for a safe old age with good falls risk reduction strategies in place. A cane, a Nordic walking baton, a walking frame, for example, a Zimmer frame, thick-soled shoes, whatever is best for him. And I hope that he's able to achieve as good a state of health that is possible for someone his age. And you, lovely listeners and viewers, what has been your experience with falls? Do you have any of the conditions discussed in this video? Or does anyone in your family or circle of friends? Do you have any questions regarding falls? By all means, I'm listening. Ask a doc.